Hello, it's Diagnosis Bona Corazza Bona, and today we will talk about some small and large bowel diseases, and so I hope it will be interesting for you, and so let's get started. Celiac disease. It's an abnormal immune response to gluten, and gluten is a protein found in wheat, rye, barley and oats. Celiac disease causes damage to the small intestine and the villi become inflamed and flattened. The surface area of the bowel that can absorb nutrients is greatly decreased. Patients typically present with symptoms of malabsorption such as fatigue, iron deficiency anemia, hyperkalemia from vitamin D malabsorption, and glossitis, and some patients have dermatitis herpetiformis, which is highly pruritic and begins as a vesiculated eruption. And it's interesting that there is increased risk of developing celiac disease amongst persons who have type 1 diabetes mellitus. Okay, and the best diagnostic test for celiac disease is duodenal biopsy. So it's a jejunal biopsy which shows subtotal villous atrophy. But at first we have to do screening tests for celiac disease, which include anti-tissue transglutaminase antibody, deamidated gliadin peptide immunoglobulin A and G, and anti-adamycin antibody. So, and as I said, a diagnostic of celiac disease shouldn't be made on the basis of a blood test alone. A positive blood test always needs to be followed by a small bowel biopsy to confirm this diagnosis. And treatment, it's a diet control, high complex carbohydrate and protein, low fat, and of course gluten-free. So no wheat, barley, oats and rye. So, and also we have to give pneumococcal vaccination because they have increased risk of pneumococcal sepsis. Whipple disease. It's a rare malabsorption disorder caused by the Bacillus Trephorrhea whipplei, and it will be different features like malabsorption, diarrhea, weight loss, large joint arthralgia, lymphadenopathy. So from skin it will be hyperpigmentation or photosensitivity. Also it could be pericarditis and neurological symptoms like ophthalmoplegia, dementia, seizures, ataxia, myoclonus. So how we can diagnose it? So the best method to find it is jejunal biopsy. So it will be deposition of macrophages containing periodic acid sheath granules. And the management, it will be IV ceftriaxone for 2 weeks and then cotrimoxazole or tetracycline for up to 12 months. Acute gastroenteritis. It's a common intestinal infection disease and causing a combination of nausea, vomiting, diarrhea and abdominal pain. Mainly caused by rotavirus and adenovirus in children, and in adults it's a norovirus. And also it's important for acute gastroenteritis is control dehydration. For children it will be just to with the child, and preferably without clothes and on the same scale each time. However, the easiest is clinical assessment, like it's vomiting, no urine, lethargy and thirst. And for in adults, important clinical features of dehydration include tachycardia, hypertension, reduced skin turgor and oliguria. So treatment it's a self-limiting and disorder, and so we need the assessment and correction of fluid and electrolyte loss. Travelers' diarrhea is the commonest health problem facing travelers to less developed countries of the world, and it's usually caused by E. coli, which produces a watery diarrhea with 14 days of arrival in a foreign country. So most causes of travelers' diarrhea result from ingesting contaminated food or water. And also we have to do a differential diagnosis. For amoebiasis, it also will be a fever and blood or mucus in the stool. For giardiasis, abdominal cramps, flatulence and bubbly, foul-smelling diarrhea. And treatment will be fluids, glucose electrolyte solution, and of course in severe cases we have to give antibiotics like norfloxacin, azithromycin or ciprofloxacin. Pseudomembranous colitis. It's a antibiotic exposure leads to overgrowth of Clostridium difficile in the bowel, which leads to increased toxin production and causes mucosal damage, inflammation and necrosis. So PMC is usually associated with watery diarrhea, fever, abdominal pain or cramping, leukocytosis, and and we can diagnose it by characteristic lesions on sigmoidoscopy, and also we can do test the stool for Clostridium difficile toxin. And the treatment, of course, we have to cease antibiotic, and for mild to moderate treatment will be oral metronidazole. For severe cases, oral vancomycin with IV metronidazole. And this colitis can be caused by the use any antibiotics, especially clindamycin, vancomycin, ampicillin, and cephalosporins. And it's usually due to an overgrowth of this Clostridium difficile, which produce a toxin that cause specific inflammatory lesions, sometimes with a pseudomembrane. Okay, and it's interesting that these symptoms like watery diarrhea, abdominal cramping, they occurred after 4 days of antibiotic treatment. But it's interesting that symptoms can occur up to 6 weeks after antibiotics have been discontinued. Toddler's diarrhea. It's also known as chronic non-specific diarrhea of childhood, and it's one of the most common causes of chronic diarrhea in otherwise healthy children. And children with toddler's diarrhea often have 5 to 10 episodes of loose, watery, large stool per day, stool with undigested food particles, diarrhea lasting weeks, followed by week of normal stools. And treatment will be just dietary adjustment. So next is inflammatory bowel disease. So we will talk about ulcerative colitis and Crohn disease. So for IBD, its clinical features are bloody diarrhea and mucous colonic pain and fever, feeling of incomplete defecation, weight loss and malaise. And it's interesting that there are some extra abdominal manifestations such as arthralgia, low back pain, some eye problems, liver disease, and hepatic steatosis. Also could be primary sclerosing cholangitis, colitis, and some skin lesions like pyoderma gangrenosum or erythema nodosum. And sometimes it's quite difficult to determine the diagnosis simply from symptoms. Also, ulcerative colitis is more likely to be associated with bloody diarrhea and cramping abdominal pain, as opposite to the colicky pain often seen in Crohn's. So, Crohn's patients can present not only with lesions in the colon, but also with lesions in the small bowel and even oral. It could be even oral ulcers. And diagnosis we can for Crohn disease will be biopsy, and we will see in Crohn disease it will be non-causating granulomas with mononuclear cell infiltrate, so it will be granulomas. For ulcerative colitis, on the other hand, it will be reveals crypt, abscence, and micro-ulcerations, but not granulomas. And for ulcerative colitis, when with also could be barium enema, and it often reveals a lead pipe colon with loss of Hauster. So treatment is antibiotics, it's usually mesalazine, and it's also we can add corticosteroids, and for severe disease it could be infliximab, but if you want to give infliximab you need to document it negative PPD, because there is a risk of reactivation tuberculosis. Next is irritable bowel syndrome, and it's a diagnosis of exclusion. It's a long-term disorder that affects the large intestine or colon. Symptoms are cramping abdominal pain. Usually it's central or iliac fossa, Pain usually relieved by passing flatus or by defecation. Also, it could be diarrhea or constipation, and constipation more common. Diarrhea usually worse in morning, and diagnosis is quite difficult because it have to be physical examination, investigations like AFB, ECR, stool microscopy and culture, also colonoscopy, and it's interesting for irritable bowel syndrome. Insufflation of air at colonoscopy may reproduce abdominal pain. It's just for IBC. And also it could be the hydrogen breath test is also used to diagnose irritable bowel syndrome. Treatment is just dietary. This patient have to eat more fiber, avoid gluten, and follow a special eating plan called the low FODMAPs. And also this person have to increase his or her physical activity, reducing stressful life situation as much as possible, and getting enough sleep. So next is diverticular disorder, and there is diverticulosis. It's usually symptomless, and diverticulitis. It's infected diverticulum and symptomatic. So it could be constipation or diarrhea, and also it could be intermittent cramping, lower abdominal pain in left inferior fossa. It could be tenderness in this fossa. Also, it's interesting that common cause of massive and painless bright red blood per rectum is diverticulosis. And as I said, diverticulosis is usually symptomless, and diverticulitis it's abdominal pain and fever. Of course, fever if there is inflammation, it will be fever. And treatment for diverticulosis, it's is lifestyle modification in the form of increased fiber intake, and fiber allows for the creation of large bulky stool that increase the width of the colon and minimize the likelihood of diverticular development. Okay, and diverticulitis, we have to treat, of course, with antibiotics, IV antibiotics like amoxicillin, gentamicin, and metronidazole. Also, diverticulum. It's a common congenital circulation of the antimesenteric border of the ileum. So it's here, you see, it's a small bowel and large bowel. And here there is this diverticle. Usually it's symptomless, or it could be crampy abdominal pain, nausea or vomiting. It also bleeding from Meckel's diverticulum is the most common cause of gastrointestinal bleeding in children and young adults. And so how we can diagnose it? It's angiography, Meckel's scan, and retinucleate imaging. So treatment, if it's asymptomatic, we don't have to treat it. But if it's symptomatic, it requires surgical removal. And the last three conditions, it's you will see them in children, and it's intussusception. It's when a part of the intestine slides into an adjustment part of the intestine, and it's usually children between 3 months and 2 years, presenting with sudden onset of severe colic abdominal pain, coming at intervals of about 15 minutes and lasting for 3 to 2 minutes. And and it's quite danger condition, and if it's a really surgical condition, it have to be signs like increasing pain, bile stained vomiting, gagging or abdominal rigidity, and distension. Also, it could be vomiting, lethargy, pallor with attacks, and science. It's how we can diagnose it. So it's will be sausage-shaped mass in right upper quadrant, and anywhere between the line of colon and umbilicus. Also, it could be sign dense. It's emptiness in the right inferior fossa to palpitation. And also it could be red currant jelly. It's the passage of blood and mucus. And it either could be Intussusception or valvulus. So treatment is hydrostatic reduction by air. So, and of course it could be, if it doesn't help, it will be surgical intervention. Pyloric stenosis develops in the first week of life, and it's caused by hypertrophy of the pyloric muscle, which obstructs gastric outflow, and it's usually males and firstborn infants. Symptoms include progressively worsening vomiting, which becomes projective and is non-bilious. So on examination, peristaltic waves may be seen, and an olive-sized mass is usually palpate in the right upper quadrant. So also it could be biochemistry. It will be metabolic alkalosis with low sodium and low chloride. And so as you see, the gold standard for diagnosis is abdominal ultrasound. And treatment, it's also of course it's a surgical. It's mainly surgical and requires longitudinal pyloramectomy. Okay, and the last one is Hirschsprung's disease, and it's an absence of ganglion cells in the neural plexus of the intestinal wall, and it's most common in boys and girls, and of course it's the delay passage of meconium together with distension of abdomen is the usual clinical presentation. And a plain abdominal X-ray will demonstrate dilated loops of bowel with fluid levels, and the barium enema can be helpful when it demonstrates a cone with dilated ganglion proximal colon and the distal aganglionic bowel failing to distend. And so symptoms constipation from infancy, anorexia and vomiting, and it will be a treatment resect narrow segment after preliminary colonoscopy. So that's all. Thank you for watching my video, and I hope it was helpful and interesting, and so I hope you will watch my other videos, and so thank you and bye bye.